Hello, everyone. It's Dr. Cary Yurkiw, and welcome to our webinar on workstation ergonomics for good posture and health. If you have any questions during the webinar, feel free to type them in the chat. I'll be happy to get to them either immediately or at the end of the webinar. This was a request from one of the people who were attending our webinars, and they wanted to know more about ergonomics, how to set up their workstation, what to do as far as uh, the desk setup or their workplace setup. So today we want to go over the best way to set up uh, for your workplace, and that way you can prevent injuries and repetitive strain in the future. My name is Dr. Cary Yurkiw. I've been practicing for 26 years, and I saw a chiropractor when I was young. So I was having a lot of knee problems, and my parents took me to our family doctor, and our doctor checked my knees and basically said that they're just growing pains. And the knee pain continued. I continued to play hockey. I played sports and at school, and whenever I fell on the playground or on the ice, bumped a desk at school, I had excruciating pain in my knees. And that's when my father heard of a chiropractor that was practicing in our area and took me to the chiropractor. He basically examined my knees. He did x-rays, and what he found out was I had a condition in my knees where the knees were not growing properly. There were misalignments in the knee and the hips. And he said what he would do is start to adjust my knees and my hips and my spine because they're all connected. And he explained how the nervous system was connected from the brain to my knees and down my legs through the sciatic nerve and the nerve flow through the spine. So he started doing these adjustments for me. And after a few months of care, my knees healed and I was able to play hockey again, and I was able to play sports, and it really changed my life because at that time I wanted to play at a higher level. I was playing at the lowest level of hockey. I just started a couple years before. The knee pain was holding me back, and after going through that chiropractic treatment, it removed that obstacle for me, and I was able to play at a much higher level and went up through the ranks until I got to the top of the hockey world in 2 or 3 years. So at that point, I decided I wanted to become a chiropractor, and I wanted to help other people like this chiropractor help me. And so from basically high school right through, I went to chiropractic college in Toronto, and then I returned to Winnipeg, where I was from. I practiced there for a number of years, then in Penticton, and now I'm located in Kelowna. So it's been, I've been practicing for 26 years, and I just want to share the knowledge and experience I have with you today. So what is ergonomics? What does that mean exactly? Well, it's the way that your body is positioned at your desk or at your workplace. What we want is efficiency so that you can do that for a long period of time, not only for that day, but we want to make sure over your career, you can continue doing what you love to do. So we don't want excessive strain on certain joints where they start to wear out or get inflamed or degenerate, get arthritic because they're getting overused, and then other joints aren't getting used enough. So we want to see the proper balance, the right posture, and the way that the joints are used in the workplace. Just a disclaimer, if you have joint pain and if you have problems with your workstation, definitely see a health professional, somebody like a chiropractor who's going to be able to assess you and then give you the proper recommendations, because what I'm talking about today may not apply to everybody. So it's important that your health professional knows your unique situation and can give you the best advice. So what are the key ingredients in a workspace? Well, number one, it's you. It's your body, your joints, the way you're aligned. So that's the first consideration. And then your desk. So the way that your desk is set up, your desk height, where your monitor is located, your screen, the chair you have, if it has armrests, and your keyboard, and then your mouse. Some people have more than one screen, so they have two and they're looking right to left, or sometimes they set up the screens because there's only so much space on the desktop. So they have two monitors, but they're off to the right side or the left side. And over time, if you keep looking one direction, it's going to cause repetitive strain in the neck area, and it can start to cause some problems in the neck and the shoulder. The benefits of good ergonomics and posture are your health. Of course, physically, you're going to feel better if you have good ergonomics. Your organs are going to function better. If you have good posture, you have enough room for your lungs to expand and contract, for the heart to beat, all the other organs to function properly, the muscles to relax and be symmetrical. So really, good ergonomics and good posture are important, not only for joint health, but for the organs to work right, for your energy, your productivity, and just good posture. It just comes off as being more confident. If we look at the desk height and the way that someone is seated or in a quasi-seated position, or maybe standing, if you look at the far left, in this picture right here on the left, this person is sitting, and the monitor is 18 to 24 inches. So that's 1.5 to 2 feet away from them. So that's an ideal position for the monitor. And the monitor should be at eye level. If the monitor is a little higher than this picture, that's okay too. I kind of aim for the middle of the screen. On this picture, it's showing the top of the screen, but I would shoot for the middle of the screen, depending on how you use your monitor and how big it is. But the middle is going to be best because there's going to be information on the top of the screen and the bottom part of the screen that you're going to want to refer to. Your chair should come up most of the way up your back, so you want to make sure that you have the proper support. And it's good if the chair has a bit of a curve to it. On this chair, it's very flat, but you can see in the lower back, there's a curve forward called the lordosis. Now, this is where your health professional is very important, because if you have the proper lordosis, which is a 50-degree curve in the low back, you're going to want a cushion or something to fill in the gap there, the white space on this picture. So having a lumbar support is important. Some chairs come with it. I've seen chairs where people don't use it properly. It's at the bottom of the chair or maybe not positioned right. Make sure that that cushion is a little bit off of the bottom of the chair where the curve goes in your spine. That's the lordosis in the lumbar region. And then, of course, you want to be comfortable where the hips and the spine meet. That should be a 90-degree angle. And then the knees should be at a 90-degree angle. So they should be comfortable, and you should have the right support for your legs. And then your feet should touch the ground and be comfortable resting on the ground. Some people that are shorter, they have a hard time reaching the floor. Then you have to adjust the position of the desk and everything to get the feet and the chair to get the right resting position of the feet. If you can't do that, you might want to put a block or something in for the feet to raise the feet up to take the stretching out of the low back and the knee area. Then for your elbows, if you look at this picture, you can see it's a 100-degree angle there in the elbow. So you want to make sure that your forearms are resting on the chair and that the elbow is comfortable, and you can work on your desk with your arms very easily. You might want armrests. Armrests will help the shoulders just to take the stress off the shoulders. And then your mouse, of course, should be close by and easy to move on your desk. So in this position here on the left, shoulders are relaxed, your back straight. The circulation in the legs will be good because there's no pressure on the blood flow or the nerve flow going down to the legs. There's a healthy hip and knee joint position at 90 degrees in the hips and 90 in the knees, and your feet are flat on the floor. The second picture, it's similar, but the angles are going to change. And I would recommend that you change positions frequently. Every half an hour to an hour, you should stand up or walk around. If you can get a desk that elevates, some of them mechanically elevate or they're automated. It's good to be able to change positions and stand up or go to an inclined seated position like this. So in this one, the hips now change to a 130-degree angle from the hip to the thigh. The elbow changes a bit to 95 degrees because of the elevation. The desk height goes up. The monitor is still in the same position, but now the desk is at 32 to 37 inches off the ground. And there's a bit of a flex in the knees now, 135 degrees versus 90 degrees. So it's good to have a comfortable bend in the knees, and then there'll be a bit of a bend in the ankle as well. Now, if you've got some ankle problems or knee problems, talk to your health professional, because they're going to guide you as far as what you can do if you're in this position. Or if you're experiencing pain in the joints, make sure you talk to your health professional as well. In the last position here on the far right, the shoulders are relaxed and the person's in a standing position. Their back straight, the ear, the hip, and the ankle are lined up, which is proper posture or gait. The back is straight, the pelvis is in a neutral alignment, the circulation in the legs will be good, and the hip, knee, and ankle joints are aligned with that plumb line, that gravity line. Again, 18 to 24 inches away from your eye level to the monitor. I would have the monitor up a little bit so that you are looking straight ahead in the middle of the monitor. That's the only thing on this picture I would change, is just raise the monitor up if possible so it's a little bit higher, okay? And then here the desk is 38 to 42 inches off the ground. When we talk about posture, well, what is good posture and what is poor posture? If we look at the picture here on the right, we see normal posture as having 3 curves in the spine. The neck curves in, the mid back curves outwards, and the low back curves inwards. So that's a normal curvature of the spine. If the curve is excessive, like in the second picture here on the right, then that's called an increased lordosis, or the back starting to sway forward. We don't want too much of a curve because it stresses the joints and it increases the pressure on the discs and the nerves. If we look at the spine right to left and it has a curvature, we call that a scoliosis. So a scoliosis is actually a sideways curvature of the spine. A kyphosis is when the back is too rounded in the middle. And you might see this if you go to the mall or you're out in public. You'll see people with an increased kyphosis or a hunched back. So we don't want to see any postural disorders or distortion. We want to support the normal alignment as best as possible. Some things to consider are you want to make sure you're physically active. So if you're not, the muscles in the body will weaken. If you carry things on one side more than the other, your posture will shift. If you wear improper footwear, it's going to change the angle of your ankles and your knees, so you'll be too far forward, and then the back will have to adjust for the posture, so there's compensation. If you're lifting heavy objects, and today I'll get into some ergonomics of lifting, if that's what you do at work. There's genetic predispositions, and then we went over the incorrect workplace position of your monitor. Some things you can do are you can go to a health professional and get some treatment. A healthy diet helps to support the bones and the joints. Good sleeping positions like a good mattress, carrying a backpack or carrying a bag balanced on your back is important. Physical activity keeps you strong. The right alignment in the workplace. And then just getting outside and getting some exercise is good for you too. So we went over these curvatures here on the last slide. I won't go over that. The only one we didn't go over was the flat back, which is the 4th one from the left. And here, sometimes there's not enough of a curvature in the spine and we see the back really flat, which changes the rib cage and changes the shoulder alignment. So we do see that in the clinic as well. Something to consider at the workplace as well is a text neck. And you've heard of that, where maybe you're looking at your phone or you're looking at your monitor and your head's forward. This is interesting because what it shows us is if the head is on top of the shoulders properly, so basically the posture is good and the alignment, the, the head weighs about 5 kilograms. But if the angle changes, so if you have your head forward looking down at a 30-degree angle, the head now weighs 18 kilograms. So that's a lot more stress on your joints. If your head's forward at a 45-degree angle, then the weight of the head is 24 kilograms. That's a lot more. And then finally, if your head's at 70 degrees looking down, then it's 28 kilograms. So that's something to consider, because if that's being done repetitively day after day, it's going to wear the joints out a lot faster in the neck and upper back, and you're going to get degeneration or wear and tear, arthritis in the spine. If you're a care worker and you're working with patients, let's say, like a nurse or a healthcare aide, make sure that you're conscious of the position of the bed and the patient. So I know there's a lot of training out there and a lot of techniques in order to move patients and to assist them, but the height of the bed is very important in how you're going to approach the patient. Lifting the patient is important. There's assisting devices or the teamwork to do that. So be very conscious of your back. Nurses are one of the highest rates for injury of the low back or lumbar spine. I think they're number 2 behind truck drivers. So if you're a nurse or a healthcare aide, just be very careful of your back and your posture and lifting and moving patients. And we'll get into that a little bit more here. If you're a paramedic, using the right equipment to move the patient and to put them on the stretcher so you can get them into the ambulance or from the ambulance into the hospital. That's very important. Be careful of reaching and twisting your body. I know sometimes it's necessary, but the reaching and twisting can really put stress on a certain area of your spine, and that can injure that area. Again, lifting and teamwork is very important if you're working in this capacity. If you've got a job lifting, and last week I had a patient who was talking to me about working in a warehouse, the way you lift boxes is very important, and the way you're placing them. So if you're not lifting correctly, what will happen is you'll strain your back, and then eventually it'll cause some injury. So for lifting, bend at the waist, make sure that you have a good angle between the back, a flatter type of back, not a rounded back, but a flat back, a good posture. We call that the spine angle. So we want to see a neutral spine, bending at the waist and bending the knees to use the muscles in the leg as well as the hip and the back to do the lifting. When you lift the object, 2 hands facing the object, and then when you go to place the object down, make sure you're facing where you're placing it and not twisting and reaching to cause a fulcrum or a pendulum that would cause torque on your spine and possibly injure it. If you're a cashier, and we see a lot of cashiers, it's important that your checkout is set up properly. So the height of your monitor is important. Here the monitor is too low and this person's going to be looking down at the monitor. The height of the table, if you can adjust it, that's good. Or maybe you can get some props to get the keyboard to be a little higher, so you can make some adjustments to it. The way you're reaching for objects, including things like groceries, if you're reaching and twisting, that's going to hurt your back. It could also hurt your wrists, your elbows, and shoulders, so be really careful of how you're using your body, the mechanics, and your workstation if you're set up as a cashier. Finally, if you're standing all day, the footwear you're wearing, you need enough cushioning. I recommend for my patients to get a shoe that has some cushion to it, but also it's flat across the front and back. So if you look at the sole, you shouldn't have a thick sole on the back and then a thin sole at the front, causing a bit of a lean forward. You really want to have a flat platform that is equal in the front and the back and gives you enough cushion. You might need some arch supports in there or orthotics, but that can really help you to have the right position of the foot and the ankle so your feet don't get sore over a long period of time. Having a stool or a chair in that area can really help. So if you can take a break or maybe lean on a stool during your shift, that'll just take some weight off. And if you can change positions every half an hour to an hour, that'll really help your joints. If you're a truck driver, this is the the occupation that is most commonly injured for the back. A lot of times for that, it's the vibration. And I know the seats have gotten a lot better for truck drivers, but you want some cushioning, like air cushioning for the back, because as you're hitting bumps and you've got the vibration of the road, it really starts to work away at the discs. And the discs have like that dough material, the ligament on the outside, and the fluid in the middle, like a jelly donut. So you don't want that dough to start to break down and then the fluid starts to push into the dough part, causing a bulge or a disc herniation. So really you want to minimize the vibration, get a seat that's going to help with the shock absorption. Make sure the pedals are accessible so you don't have to reach for the brake and the gas pedal. Make sure if you're shifting that the shifter is at a comfortable height so you can easily reach it and shift from one gear to another. Make sure your seat is set up properly so your arms are comfortable with the wheel, as well as your head is looking forward down the road so you're not looking down or up at a bad angle for your neck. What are the effects of poor alignment? Well, if you do have a poor workstation setup, it's going to affect your spine. Your spine could get crooked. You could get misalignments or what we call subluxations. The spine will start to degenerate over time, so the discs and the bones will wear out faster in certain areas because they're getting overloaded. So there'll be uneven wear and tear. It could affect the nerve flow going through the spinal cord because the nerve flow goes from the brain down the spinal cord. One of the common conditions we see is if the discs break down and the spine breaks down, the material pushes out the front and the back part of the spine. And if it pushes into the back part of the spine where the spinal cord is, that's called stenosis. And stenosis is a narrowing of the spinal canal, which can start to cut off the nerve flow going down that main highway. That can lead to some more serious complications like weakness in the legs, problems walking, or even just moving around. So you can really lose power to your legs if there's stenosis that develops because of poor alignment and degeneration in the spine. So we don't want to see our patients degenerate and end up with poor health. The phases of degeneration in the spine, the optimal curve, and this is the neck, is 42 degrees right here in the cervical curve. So when we look at an x-ray, and we take digital x-rays in our clinic, when we look at an x-ray, we want to see this. When the spine doesn't have the right alignment, it's flat and it loses its curve. And we call this phase 1 of degeneration when someone has poor posture. And this is the most common type of misalignment that we see. If it stays that way and it's not corrected back to the way it should be over time, over months and years, it'll degenerate and go to phase 2, where the bones start to break down. I don't know if you can see my cursor here, but between the 5th, 6th, and 7th cervical vertebrae, there's some bone spurring and osteophytes developing where the discs are narrowing and now the bones are changing shape because there's a change in the posture of the neck alignment on the shoulders. If that continues, the bones will get squished together and the material will get pushed back into that spinal canal and affect the nerve flow coming out of the nerve roots. So this is phase 3 of degeneration. And then finally, the bones are all squished together. There's very little movement. Of course, the muscles are affected, the nerve flow, there's pain that accompanies these phases, and the nerve flow can't get through here at phase 4 when there's so much stenosis in the spine. So we want to stop this as a chiropractor, and we want to reverse it as much as we can so that the person has good posture, they have very good alignment, and long-term they stay in good shape. So what can you do? Number one, just attending this webinar, being more conscious of good ergonomics is important. You can put reminders up on your screen, maybe a sticky note just saying reminder for posture, reminder to adjust your chair, or maybe if you share a workstation or if you're a bus driver, to adjust your chair if you're switching buses. So just little reminders to make sure you make those adjustments and that you get up every 30 to 60 minutes and change positions, because if you're in one position too long, it's too hard on the spine. It compresses the spine and it makes it very difficult for the spine to adapt to that. You can do exercises, you can work on your core strength, and you can go to see a chiropractor or another health professional that deals with posture and ergonomics. What are some core exercises you can do? Well, some core postural exercises are things like planks, what this lady's doing. You can do extensions for your back, so you can do that with some weight if you get good at doing that in the gym or at home. You can do abdominal crunches, or basically working the muscles around the spine, the core muscles, to support them. You want to work the side muscles, the lateral muscles around the spine. Don't forget about your neck and your shoulders. So you basically want to build up core strength. So as the day goes on, the muscles are assisting the spine and the ligaments to keep you in a good posture and a good position. As far as assessment and treatment, if someone comes in the clinic, I look for postural landmarks. So I want to see if the shoulders are level, the hips are level. When they're lying on the table, are their leg lengths even? If they're standing sideways, I want to make sure that the ear, the shoulder, the hip, and the ankle are lined up, like the picture we had earlier in the webinar. So we're looking for these postural landmarks. If there is poor posture and I do an assessment of the ranges of motion and there's some deficits, you can only turn 50% to the right, and yet you can turn 75% to the left. We know there's some postural imbalances. And then we might take some x-rays to look at the condition of the spine, make sure we see if there's any pathologies there. And then we have a starting point as far as corrective care and doing a reassessment in the future. We do use telehealth in the clinic. We've started using that in the last few months. I really like telehealth because it allows me to follow up with the patients and see how they're doing with their stretches and exercises, but it also allows me to see their workstation. So if they're at work and they're on a video, and we use a secure platform called On Call. If they're at work, they can show me the workstation and I can make some recommendations. If they can't do that, I've had patients bring pictures into the clinic or send me pictures of their workstation and their setup and made recommendations to them. So I'm happy to do that for you if you're a patient of ours, just to help you to get a better setup at work. How long does it take to correct posture and alignment? Well, it can take weeks to months, depending on how long it's been there. So if the postural distortion has been there for years, it's going to take a few months for it to get better. If it just got there, it could only take a few weeks for you to improve. So it all depends on the length of time and the other factors, like if you've had previous injuries before or whiplash, like a car accident. What we want to do is improve your nerve flow, your energy, your circulation, improve your posture, make recommendations for you for better self-care, and then we want to see long-term stability and strength of your posture, your spine, and your body in general. If you have poor posture, poor ergonomics, I'd be happy to assess you. We are taking new patients in our Kelowna clinic, so you can just call this number here, 250-486-0062. I'd be happy to assess your posture, your alignment, and your workplace situation, your ergonomics. I did write a book. It's on Amazon. It's on back pain. We talked about some of these topics in the book. It was published last year. So if you type in back pain on Amazon and my name, Cary Yurkiw, you'll see that back pain book. And there's a Kindle version. So it's in Kindle Unlimited. So you can get the ebook. There's a paperback. And then there's an audiobook too, so you can actually listen to it on Audible. There's more webinars coming up, so make sure you follow us on Eventbrite and type in Yurkiw Chiropractic and you'll see our events. They're constantly getting updated. There's usually 4 or 5 webinars coming up. This is the current list. So we just had Do You Have Poor Posture on September 1st. Today, September 4th, we're doing workstation ergonomics for good posture and health. On September 6th, we have a webinar on rotator cuff syndrome. And then we have a new patient introduction, September 7th. This is for patients that are new to the clinic, and we want to make sure we educate them and spend time explaining chiropractic care, what should they expect in the clinic, and what they should do to help themselves. We're located at 105 1628 Dixon Avenue. That's the Landmark 4 building. It's the tall glass. There's 3 glass buildings together where the white walkway goes across Harvey or Highway 97 in Kelowna. So we're located in one of those glass buildings, the one in the middle, Landmark 4, and that's at 1628 Dixon. And if you have any questions, you can email me at drcaryyurkiw@gmail.com. Be happy to answer your questions. Feel free to send me an email and I will respond, and just give me a little bit of time. Usually I can get to the emails within about 24 hours. If you're watching this video, you're not a patient of ours, or you're watching the replay on YouTube, we do offer 10% off the initial assessment if you've been to a webinar like this. So you can contact our office, send us a message, and we'd be happy to book you in as a new client. This offer is good for 7 days till September 11th. And just use the code ERGO for ergonomics so that we know you've been to the webinar and that you'd like to take advantage of that offer. I'd like to thank you for joining me today. I appreciate your time, and I look forward to seeing you at the next webinar coming up in a few days.